Now moving on to a different subject, 26 million Americans suffer from asthma, and up to 10% have severe asthma.
Now with those statistics, we had to look into what is available to help those that are suffering.
Asthma is a chronic lung disease that causes inflammation and narrowing of the airways. It can be a daily issue for some, cause attacks in the middle of the night, and oftentimes is not made better even with high doses of medication. Well, there are several causes to this disease, and it is important to remember that not all asthma is the same. Joining us this morning is Dr. Mark Forshag and Donna Matlock. Thank you both so much for being here.
Thank you, Heather.
Thank you.
So Donna, you actually suffer from what we call severe asthma. So tell us, how did that come about? How did you even realize that that is what you were dealing with?
Well, originally I had asthma that was controlled with an inhaler and a corticosteroid, but then progressively as time went on, my symptoms became worsened to the point where they were debilitating. For example, I couldn't, do normal things like walk the dogs or anything, tie my shoes, any type of exertion. Despite all the medications my physicians had prescribed for me, it still wasn't enough. And we had to search for extra specialists and just find out what else we could do to, try and get this asthma under control. Because as you said, all asthma is not the same, and all treatment's not the same.
Well, exactly. And doctor, we know lots of people who suffer from, minor asthma or regular asthma, as we might call it. But what really is the difference between regular asthma and the severe asthma?
Well, it is a gradation, but the real difference is the impact on patients' lives. So if you have someone who has mild asthma who's using their inhaler, their rescue inhaler, a couple times a month, that really doesn't have an impact. But in severe asthma patients, there's persistent inflammation, and it's always there. And they're always just one or two steps away from having an attack. And they tend to have symptoms from their ongoing inflammation on a daily basis, and then those more severe attacks come on a frequent basis that's very disruptive to their lives. We're learning more and more about the underlying causes of severe asthma, and what we're doing is we're dividing patients into smaller and smaller groups based on their biochemistry and based on their triggers, and trying to tailor therapy specifically to each of those groups to get the best result the fastest.
Well, now I know that a lot of people with asthma treat it with different varieties of medication. Tell us, what is personalized medication?
So personalized medicine is that process of dividing patients into progressively smaller groups so that instead of having a one-size-fits-all approach, which is what we had years ago, where everybody was treated the same with the same progression of medications, now we're saying, okay, we're going to go out of order, and we think this medicine will work for this patient, whereas this one won't. So we're going to change up the order. Ultimately, we'd like to get to the point where we look at a patient's genetic makeup and we tailor therapy that is absolutely specific to that patient. We're not there yet, but we're getting closer and closer.
So, doctor, we've heard of something called eosinophils. Tell us what that is and how it's related to severe asthma.
So eosinophils are a type of inflammatory cells, and inflammation gets a little bit of a bad name in lay publications, but actually inflammation is necessary to fight off infections, it's necessary to heal wounds. But in some cases you have inflammatory cells that go a little bit rogue. They're overactive and they cause inflammation when they shouldn't. The eosinophil is a type of inflammatory cell that tends to be active in asthmatics, but in particularly in about half to 60% of severe asthmatics, it's clearly overactive, and targeting that cell in those asthmatics can improve their control.
So doctor, have there been some advances in medication for asthma sufferers?
There really have been. So, starting with going back 30 years ago, inhaled corticosteroids are very good for eosinophils. And not only have we had them for that length of time, we're getting more potent and more directed inhaled corticosteroids. But now for those patients who don't respond to ICS, we're also getting monoclonal antibodies that specifically target the chemical that upregulates eosinophils.
Well, I know we're quickly running out of time, but Don, I want to ask you about the Severe Asthma Foundation.
It's a foundation we founded last year. There were no other foundations like it. There were asthma foundations, but we're targeting making people aware that there is something besides asthma, and not all asthma is the same. And severe asthma is a very serious, uncontrolled disease, and we are trying to do the best research and get the best doctors to give us information and help us give that to the patients.
Well, thank you so much. Doctor, is there anywhere we can go for more information?
So your physician is the best single point of information, but there's a wonderful online resource called asthma.com, ASTHMA.com, that's very patient-friendly.
Great. Well, I want to thank you both so much for joining us.
Our pleasure.
Thank you very much.
Now stay where you are. The Morning Blend will be right back.